Welcome back. Daybreak time is 5:44. Taking a look at health news. New studies are showing what's caused the most deaths for Americans over the past several years. Dan Cohen joins us live in the newsroom with more. Dan.
Good morning and thank you, Abby. So a new government report reveals that while the overall life expectancy for Americans has remained stable over the past few years, there have been some changes. Now, deaths from heart disease, cancer, flu, diabetes, and lower respiratory diseases significantly decreased from 2013 to 2014. And deaths from accidental injuries, stroke, and suicide had large increases during that same time. But death rates from Alzheimer's disease had the greatest jump, jumping more than 8% in just 1 year. Meanwhile, the infant mortality rate dropped to an historic low. Studies have shown that smoking during pregnancy poses risk to the mother and the baby. And now new research finds that young men exposed to prenatal smoking may have lower aerobic fitness than their peers. Running tests of over 500 19-year-old men revealed that those whose mothers smoked more than one cigarette a day throughout their pregnancy were less fit than men who were born to non-smoking mothers. A new online training program for those interacting with people with autism is now available in the Buckeye State. The program is called ASD Strategies in Action. It's available to anyone that lives or works in Ohio for free. If you're living in another state, you could purchase a subscription to the program. And it's designed to help families and agencies gain the skills needed to support children and young adults with autism through a series of modules.
You're going to see where the child is at, or the individual or the adult. You see where they're at, and these will help you to move forward with them and how to interact and how to engage with those individuals with autism.
To be good citizens, to be good neighbors, and the opportunity has presented itself for us to learn more so that we can be truly engaged with individuals who have autism.
And you can find more information on the program at our web channel, thenewscenter.tv. Also in this morning's health report, bladder cancer is highly curable if caught early. So a doctor and patient are working to make sure that everyone knows the warning signs. Renee Tespin reports.
Would you call that conservative or would you call that aggressive?
In his role as an adjunct professor teaching investments at Bethel University, Dean Junkins knows all about risk. And he worries that some people take a big risk if they ignore symptoms of bladder cancer.
Pain urinating, eventually I ended up having blood in the urine, and that was sort of a very serious sign.
Junkins was diagnosed 3 years ago.
And I actually started my treatment on Black Friday of 2012.
Luckily, majority of bladder cancers are more in the early or superficial stages, so they can theoretically be treated, and majority of these patients can be cured. Over 85% of these patients can be cured.
U of M urologic oncologist Dr. Badrinath Kennedy says there's a big need to raise awareness, especially since some may be embarrassed to talk about symptoms.
Urgency, frequency of urination, burning in particular when you urinate, or blood in the urine.
Kennedy says smoking puts you at risk. Half the bladder cancers are found in smokers. But Junkins never smoked. Ultimately, he had his bladder removed and a neobladder constructed.
Taking part of my small intestine and hooking it all up and creating a new bladder, which is amazing.
Now cancer-free, Junkins is not just teaching investments. He helped form a local support group and is teaching others that ignoring bladder cancer symptoms can be deadly.
Don't delay, get in to see a doctor.
Now, Caucasians are about twice as likely to develop bladder cancer as African Americans. The risk of bladder cancer also increases with age. About 9 out of 10 people with bladder cancer are older than 55. That's your morning health news. Send it back to Abby in the studio.
All right. Thanks so much, Dan.